Patrícia Deps, professor in the Department of Social Medicine at the Federal University of Espírito Santo in Vitória, Brazil. I've been invited to talk about One Health and Hansen's disease, investigating Hansen's disease using a One Health approach. Hansen's disease is known as leprosy, a stigmatizing terminology, and because of that reason, we won't use the term leprosy in this presentation. Hansen's disease is a neglected tropical disease related to a set of environmental, socio-political, and health characteristics that pose a challenge to public health policies. It is a compulsory notifiable disease that mobilizes public authorities and society for control and prevention actions. Hansen's disease is endemic in more than 100 countries worldwide, with over 200,000 new diagnoses each year and more than 4 million people living with some form of Hansen's disease-related impairment. Brazil is a high-burden country for Hansen's disease, with incidence varying according to geographic and socioeconomic determinants. Although the disabling and disfiguring sequelae of Hansen's disease are entirely avoidable if diagnosed and treated early, the social stigma of Hansen's disease has not been entirely dispelled and still has a profoundly negative impact on people diagnosed with this disease. So, Mycobacterium leprae is the most important causative agent for Hansen's disease and was described in 1868 by Hansen, a Norwegian physician. In 2009, another causative agent was identified, Mycobacterium lepromatosis. These microorganisms, when disposed off from the human body, can survive for some days under special conditions in the environment and consequently infect new humans and animals. Numerous studies prove the existence of leprae, even viable outside the human body. I highlight the recent finding of leprae inside the Acanthamoeba spp, a unicellular free-living parasite. This could host the bacillus indefinitely and be the source of the viable bacillus for animals and humans. So the mode of transmission of Hansen's disease. Understanding of the transmission of leprae infection and the process of the pathogenesis of Hansen's disease is limited. The transmission of leprae is little known. It is repeated in textbooks that this transmission occurs from person to person. Undoubtedly, this is the most important mode of transmission of this disease, through mucus secretion from the nose and mouth. This theory is based on the evidence of the presence of intact bacilli in the nasal and oral mucosa. However, there are bacilli in the skin lesions, which could also be considered a form of transmission. It is said that transmission occurs from a multibacillary person without specific treatment with multi-drug therapy, but many authors consider transmission through paucibacillary patients as well. Robust evidence points to zoonotic transmission of Hansen's disease via naturally contaminated armadillos. Mycobacterium leprae also has been found in other animals such as red squirrels and monkeys, but not important for the transmission of the disease. The risk to human health of contact with armadillos infected with Mycobacterium leprae is uncertain, but evidence from Brazil and other countries appears to show a link between contact with armadillos and increased risk of Hansen's disease in people. In the United States of America, Hansen's disease is considered a zoonosis, and contact with armadillo is a risk factor for the disease. In Brazil, the source of bacilli has been considered almost exclusively from those untreated multibacillary cases. However, we suppose that how much of Hansen's disease in the human population is caused by contact with armadillo will depend on the size of the risk, the type and frequency of the contact, and how common it is in the population, and the whole of the other transmission route for leprae. Are these estimates on the prevalence of armadillos infected by Mycobacterium leprae? Yes. In 1971, researchers from USA published about Hansen's disease developed in armadillos by experimental infection. In 1975, armadillos were identified with infection naturally acquired and confirmed in other publications. In Brazil, in 2002, we found a leprae infection in armadillos from the state of Espírito Santo. Other researchers in Brazil published similar results. In 2011 and 2015, important studies showed that armadillo and humans could be infected by the same leprae genotype strain type. Many species of armadillos are often found in Brazil. In Latin America, we have armadillos in all Latin America and Central America and North of America. The armadillos came to America many thousand years ago. In this screen, we have some species of armadillos that were found infected with leprae in Brazil. So, in 2002, the first study demonstrating natural infection of leprae in wild armadillos in Brazil was published. In the sequence, all the studies were performed, and antibodies and PD-L1 in wild armadillos were detected by ELISA and ML flow tests. This study was published this year, and we did a meta-analysis, and we included 10 studies, represent the total sample of 302 armadillos in Brazil. The average prevalence of leprae in those studies performed to date is equivalent to 1 in 10 armadillos being infected with leprae. 3 studies found 0 infected armadillos, and 1 study found that all of the captured armadillos were infected. This variation is consistent with the relatively small size of the studies. But it is also possible that there are real differences in prevalence of leprae infection between armadillos population in different parts of Brazil. There were also some difference in methods between the studies, although all used a method for detecting leprae DNA, which is highly sensitive. Does the transmission of leprae from armadillos to humans involve the manipulation during butchering and preparation of the armadillo, or the consumption of its meat? Well, Mr. Hansen's disease is classified as zoonotic in the USA with recommendations regarding contact with armadillos by CDC. No recommendation have been made in other countries of the Americas, Central and Latin America, which have a high endemic burden of Hansen's disease and extensive armadillo populations. We classify the contact in 2 ways: direct contact, that would be hunting, handling, eating, butchering, preparation, and slaughtering. Indirect contact is living or working in or near armadillo habitat. Many cases report no history of previously known contact with persons affected by Hansen's disease, confirming that other sources of leprae might be thought. This is a publication in 2008, resulting from a study, case control study, that we performed in Espírito Santo State as well. In this study, it's a case control study that we carried out in Espírito Santo, and the data was collected from 506 persons affected by Hansen's disease and 594 controls on exposure to armadillos and controlled by age, sex, place of birth, and living conditions. Direct armadillo exposure was reported by 68% of cases and 48% of controls, roughly doubling the risk of Hansen's disease with odds ratio 2 and 95% of confidence interval. Conclusion of this study suggests that direct exposure to armadillos is a risk factor for Hansen's disease in Brazil. In this other study that is going to be published soon in Zoonosis and Public Health journal, we aim to identify and characterize studies which have investigated risk of Hansen's disease in relation to contact with wild armadillos, whether indirectly by living or work in and around armadillos' habitats, or directly through hunting, handling, and consumption, and to quantify the relative risk of Hansen's disease according to the type of contact. So we found that indirect contact, the risk factor, the odds ratio is 1.39. For eating, the odds is 2.29, and hunting, the odds is 2.54, and overall direct contact is 2.86. So the combined results for 9 studies from the USA, Brazil, and Colombia show that direct contact with wild armadillos is strongly associated with an increased risk of Hansen's disease. Also, we studied endemic and non-endemic country. In endemic country, we need to keep in mind that we have the main source is the human being. Contaminated, there are multibacillary case that hasn't been treated yet. And non-endemic countries is different. So in this analysis, we take this account. And endemic countries is 2 times higher odds of Hansen's disease in people who have direct contact compared with no contact. And non-endemic country is 4 times higher odds of Hansen's disease in people who have direct contact compared with no contact. Living and working in areas inhabited by armadillos carries increased risk of Hansen's disease, although evidence for this association is weaker. How can we use the One Health approach to help control Hansen's disease, especially that acquired by hunting and meat consumption habits? A reduction in transmission cannot be expected to be accomplished by actions or interventions from the human healthcare domain alone in Americas, as the mechanisms involved are complex. Therefore, to increase our understanding of the intricate picture of transmission of Hansen's disease, we propose One Health transdisciplinary research approach. So the proportion of Hansen's disease attributable to contact with or consumption of armadillo is unknown. Nevertheless, it might be a small proportion, and armadillo might just be part of an environmental pool of leprae. Therefore, this can have consequences for the control and eventual elimination of Hansen's disease in Brazil. In the meantime, it seems sensible to adopt a precautionary principle and include recommendations to avoid contact with armadillos. Educational effort direct toward changing behavior and improving community knowledge of risk associated with capture and consumption of wild animals, in case armadillos. Also, wildlife can carry multiple infectious agents. Therefore, measures to reduce capture and consumption based on quantifying the risk for one pathogen may have wider public health benefits in preventing other zoonoses. Thank you.